Hello everyone, this is the Mental Health for Life channel. In this video, we'll explain about dissociative identity disorder. The portrayal of multiple personalities in movies and dramas, like Hitchcock's Psycho, often presents two seemingly distinct individuals who are eventually revealed to be the same person. These characters exhibit multiple personalities, where two distinct identities coexist within a single body. But does such a phenomenon truly exist in reality? Let's delve into the question, are multiple personalities possible? There is, in reality, a phenomenon where another personality emerges within the mind, speaking or taking control of the body without conscious awareness. This condition is known in psychiatry as dissociative identity disorder, or DID, which involves the splitting of the mind into different personalities, which is referred to as dissociation. The concept of dissociation was introduced by French psychologist Pierre Janet in the 19th century, suggesting that individuals may develop multiple personalities as a coping mechanism to escape overwhelming trauma, such as abuse. Modern psychiatry continues to explore and study this concept, building upon the foundational understanding of dissociation. The observed separate personalities often manifest in a state of heightened excitement or confusion, triggered by impulses such as anger or sadness. For example, a common occurrence is when a typically quiet person suddenly becomes angry due to something they dislike, transforming into a completely different persona with a fierce and intense expression. They might even adopt a tone resembling that of a thug and go on a rampage. However, after a few hours or days, they then revert back to their normal self and have no recollection of the episode. Here is another example. A woman who is experiencing distress may suddenly bust out loud and begin babbling like an infant, her actions resembling those of a child. It may even seem as if she is deliberately seeking attention. However, once the people around her comfort and calm her, she returns to her usual behavior, but she cannot recall the period where she acted like a baby. Due to the restlessness and disorientation that often accompanies dissociative identity disorder, along with auditory hallucinations involving hearing voices of other individuals, psychiatrists often initially land on a diagnosis of schizophrenia. Schizophrenia typically manifests with distinctive characteristics like impaired logical thinking and apathy, which follow a different pattern compared to dissociative identity disorder. Individuals who lack these specific symptoms may later have their diagnosis revised to dissociative identity disorder. Alternatively, people with this disorder also often receive an initial diagnosis of borderline personality disorder due to their anxiety and episodes of intense anger. There was a book in 1973 that documented the case of a woman named Sybil, who had 16 personalities. This book brought awareness to the existence of multiple personalities as a disorder. It was also later adapted into a movie titled Sybil in 1976, which had a significant impact on the field of psychiatry. The book suggested that personality dissociation was caused by child abuse and emphasized the need for psychoanalytic integration as a treatment approach. Subsequently, there was a substantial reevaluation in the number of individuals previously diagnosed with schizophrenia. Many of them were either re-diagnosed or newly diagnosed with dissociative identity disorder, marking a 100-fold rise from the previous year. However, 40 years later, Sybil's case was re-examined. In 2011, it was revealed that doctors, patients, and journalists had all collaborated to fabricate the story. It appears that the motive behind fabricating the story was also linked to promoting the social movement of combating child abuse. There are numerous cases of dissociative identity disorder that do not involve the abuse and trauma portrayed in the famous case of Sybil. In fact, genetic factors and environmental influences, such as feelings of loneliness, appear to heavily contribute to the development of the disorder. It was previously believed that integrating dissociated personalities was essential for treatment. However, now many cases are effectively managed with the use of antipsychotic and antidepressant medications. As patients achieve emotional stability, the occurrences of dissociation also tend to decrease. Although we've been explaining multiple personalities from a psychiatric perspective so far, there is a long-standing belief of it being the result of spirit possession. This is because the idea of a person's body being taken over by an unseen personality is somehow easier to comprehend as opposed to just having a split personality. In psychiatric terminology, the term possession is deemed unscientific, and the term dissociation is employed instead. These possessive states are now recognized and categorized within the framework of dissociative identity disorder. Have you ever heard of the movie The Exorcist, where a girl possessed by an evil spirit is exorcised? While some may perceive exorcisms as something that only happens in movies, they are still practiced today in certain religious contexts, including in Italy. In some niche cases, if a psychiatrist rules out schizophrenia and an exorcist affiliated with the Catholic Church attributes the dissociation to an evil spirit, then they may perform an exorcism ritual. It is worth noting that some individuals even report positive outcomes after going through these rituals. Nevertheless, dissociative identity disorder remains a complex and enigmatic condition that continues to be the subject of ongoing research and exploration. This was the Mental Health for Life channel. If you liked this video, please give it a thumbs up and subscribe to our channel.